All right, all right. Thank you very much for that introduction. As always, great to see and to be seen. It's always a wonderful thing. Good afternoon, listeners. You're locked into WVOE 1590 AM, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of Pressure MD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. All right, so we're here for another lovely session where we're going to be talking about health issues that matter to everyone, really. Health issues that matter to everyone, making sure that we're giving you good information that you can utilize on a daily basis. And so today is going to be another one of those shows. So today, what we're going to talk about is your money and your health, kind of the hidden connection here. And the reason why I chose this topic is because number one, I think most people say your health is your wealth. I mean that phrase is there, and of course your wealth can actually help or hinder your health. Your health. So if you got a lot of wealth, it can help your health. If you got a little, it can also be it can be problematic. So today we're going to talk about a topic that affects almost everyone, but we really don't talk about it enough, and that is money, stress, and your health. And so, because what's happening in your wallet can show up in your blood pressure or other areas. And one of the things that happens if we don't address it, it can quietly affect your heart, your kidneys, your sleep, and your overall quality of life. So, one of the reasons why Pressure MD focuses on that high blood pressure is because if we can catch that silent killer, if we can catch that silent killer early, if we can control that silent killer early, like I said, we can, slow down or even prevent the sequelae, the effects that it will have on your heart, kidneys, and your brain. Okay, so what are we going to talk about today? We're going to talk a little bit about financial stress. Okay, and it's we're going to start simple. Like, what is financial stress? Because a lot of times we use this word, but we don't always talk about what it means and what its impact can be. So, financial stress is the worry, anxiety, or pressure that you feel about money. Okay. So, this could be from paying bills, affording grocery, affording gas, medical costs, debt, supporting family, living paycheck to paycheck. All this stuff can be financial stress. And one thing that I think people need to realize, and that is, of course, when we think financial stress, a lot of times we think about, people not having enough money. However, this actually can apply to people that make a little bit of money as well as people who make a lot of money. Because little known fact is that sometimes people that make a lot of money don't manage that money well. And so that stress, that financial stress that can hit someone that doesn't now, maybe minimum wage, can also hit someone that's making six figures if they don't manage this well. So this is not, applying to just one group of people. This is across the board. Financial stress can affect anybody, anywhere, in any financial state, especially depending on how they handle their funds. So now, one thing is that your body does not know the difference between financial stress and physical danger. Okay. So when you're stressed about money, there's no difference between that and your body reacts to stressing about money the same way that it reacts to being chased by somebody with a gun, or like I said, if you're being chased by a tiger, your body doesn't know that difference. It physically, it responds the same. So how does it happen? So your heart beating faster, your blood vessels tightening, releasing stress hormones. That fight or flight can still hit you. Okay, so when you're stressed, and that doesn't matter, like I said, it doesn't matter if it's financial stress, because you're trying to figure out how to keep your check from bouncing, or if it's like I said, you're in the woods getting chased by wolves. Just a an example out there, or that, or somebody, say somebody's robbing you, at the gas station. I mean, those are still sources of stressors. So when you're stressed, yet again, your body responds the same, and that is that heartbeat. That heart beating faster. Your blood vessels they tighten up, they get that blood pressure up, and then, like I said, those stress hormones like cortisol, that stuff kind of rises, and it does the thing it needs to do. But if it's going on for a long period of time, then that could be very harmful to you. Okay, and so over time, this could be something that can lead to high blood pressure, or if you have high blood pressure, it could lead to your blood pressure being uncontrolled. So that's the thing that can happen. So you can, if you didn't have high blood pressure, chronic stress can cause you to have high blood pressure. If you already have high blood pressure, maybe it was controlled, and then all of a sudden it becomes uncontrolled, it could be stress that is leading to that. So that's one of the things you have to look out for. Okay. And as many of you know, and we've said this many times, hypertension is called the silent killer because you do not feel it. You do not feel when that blood pressure is going high. Okay. So studies show people under chronic financial stress are more likely to have high blood pressure, and then, of course, heart disease, strokes. Why? Because if you have high blood pressure, what does that lead to? It leads to heart disease. It leads to strokes. It can actually lead to kidney disease as well. And of course, in the African American community, we're already face higher rates of hypertension. So financial stress is just contributing to that gap, making it even worse. So in addition to, we might have some genetics, there might be social ills that we're facing. And now you add to that financial stress, all that stuff is kind of compiling one on top of the other to not only cause high blood pressure, but to cause that high blood pressure to be more difficult to control, and also causing it to be a lot higher than it might be in other groups of people. Okay. All right. So think about this. If when you're worried about rent, when you're worried about your job, when you're worried about your bills, are you sleeping well? Okay. If you can't make that next rent payment, or you don't have quite enough for that next mortgage payment, do you sleep well at night? A lot of people just don't. I mean, like I said, that worry is right there. That worry is right there. So you're not sleeping well at night. Are you exercising? Most people, when they get a lot of stress, they don't pay attention to the exercise that they're doing. Like I said, maybe they were walking daily. Now they, instead, you skip that walk. You don't go to your walk group. You don't go to your hiking group. Why? Because you're worried about that bills. You worry about whether or not the light's going to get cut off. So that stuff is stressors. And now that healthy activity that you used to have, you're not doing it anymore. Okay. And then, are you eating healthy? And like I said, yeah, so some of those hormones that are released, they cause you to basically get the equivalent of the munchies. You don't want a salad, you want a burger. You want fat, you want salt, you want sugar. That's what you're going to start craving whenever you're under that stress, because those hormones that are releasing are causing you to crave that type of stuff. So when you're worried about the rent, when you're worried about your job, when you're worried about your bills, you're not sleeping well, you're not exercising, you're not eating healthy. And that's how that stress can turn into disease. And if you have a disease, can make that disease worse. So so those things to be thinking about. So let's talk about some stuff that sometimes I see in clinic. And that is patients not taking their medications. Okay. And this is in terms of medication adherence and cost barriers. So a lot of times it's not because people don't care. So we have a term that we use called non-compliance. So you go in, hey doc, I'm not taking my meds. And there's a label, non-compliant, patient is non-compliant. But one of the reasons why people don't take their medication sometimes is not because they don't care, it's because they can't afford it. Because the medication that was $5 a month last year, all of a sudden it's January and now it's $50 a month. And if you're on a fixed income, that could be right. You know what? From $5 to $50, it doesn't matter if you're on fixed income or not. That's a lot of money to be coming out of your pocket all of a sudden for something that's for just one of your, maybe 10 medications. So so the word non-compliant. As a matter of fact, when we were in med school, we were taught not to use non-compliant. We said non-adherent because you're not adhering. The patient's not adhering to medical advice because of a particular reason. And reasons are different than excuses. Excuses that's maybe a behavior thing, but reasons, a medication going up multiple times is a reason, is not an excuse. So that's a person that's not adherent to their medical therapy because of a cost barrier. And maybe that barrier, like I said, if it's $5, you might be okay. Yeah, I can do a little DoorDash. I can do something to kind of cover that. $50, that's a lot. That's a lot to be covering. Okay, so that's something to always remember. Okay, and what are those barriers? I mean, medication become too expensive. The co-pays can become high, and as everybody knows, those co-pays change all the time. Maybe you don't have insurance. Maybe you had insurance and you lost it, and you don't qualify for some of the other the government programs that are provided there. So you don't have any insurance at all, and sometimes that can lead to choosing between your medication and the food that you eat. And so that can be a tough call. And like I said, or maybe you got a family, and it's the difference between your medication and food for the family. So those are things that are real, and they are things that that have to be addressed. And sometimes people will try to stretch the pill to make them last. All right, I'm gonna take, instead of taking the whole pill, I'm gonna cut it in half. Instead of taking a pill every day, I'm gonna take it every other day. Try to see if I can make it go until my check comes through. Or maybe you're trying to choose between a medication and a light bill. And in the summertime, like I said, that electricity bill, it kind of goes up because you got air conditioning. And then, like I said, in the wintertime, the gas bill goes up because you're trying to heat the house. So now you add that to the cost of medication going up. This creates an actual financial barrier to getting, not to acquire, to getting and taking your medication. So this is a real deal. Okay. And why is this dangerous? Okay. So skipping medication can lead to uncontrolled blood pressure. It can lead to kidney damage. It can lead to heart attacks. It can lead to strokes. Why? Because if you're, yet again, we're focused on that high blood pressure. So you're skipping medication. Now your blood pressure is kind of shooting up. Then you take the medication, it comes down. You skip it, and as it goes up, and then like you miss it, take it again, it goes back down. And so now your blood pressure is all over the place, right? So your body's not even getting adjusted to anything. And so taking medication inconsistently is sometimes worse than not taking it at all, because your body's up and down. You're probably reporting the good blood pressure to your doc. Meanwhile, you skip the day that you skip taking your medications, you don't record your blood pressure. So, your doc is thinking, oh, we're good to go. Not knowing that we're getting high levels of blood pressure in between those good blood pressure readings that are going on there. Okay. So now we talked about the problem, and one of the things we like to do here, we also like to talk about, what you can do. Let's get some practical steps. And like I said, this is not a cure-all. This is not something that can solve everybody's problem all the time. However, these are some steps that you can use to kind of help navigate this issue. So one of the things, so some practical steps you can do, you can ask for generic medications. If you're getting brand name medications, ask if there are genetic versions of that medication available. So a lot of times the generic medication is a lot less expensive than the brand name medication. So make sure you ask about that. Ask a doctor about less expensive alternatives. A lot of times, like I said, yes, you may have, a lot of times the medication that's written, that you have that medication, but sometimes there are a lot of other options, especially when it comes to blood pressure. There's a laundry list. There's a ton of blood pressure medications out there. They work different ways. Sometimes they're just what I call cousins of a particular medication, where they work similarly, but like I said, they may have been the other one have been out longer, so they may have generics. Sometimes, like I said, especially if they're on some of these reduced price lists, like places like Walmart or Target may have there may be medications that are on where you can get like a 90-day supply for $10. Okay. So those things are out there, but sometimes you have to make sure you ask. There are also discount programs out there. That one of the names that I know best is called GoodRx. Sometimes they're pharmacy saving plans, so you can always ask about those as well. And then talk openly. One of the biggest things is talk openly. Do not be embarrassed that your medication is not affordable, and is not affordable, because if you don't tell someone, no one can kind of help navigate that area, that space. Okay. So never suffer in silence when it comes to medication costs, because your doc cannot help if they do not know. So yet again, they cannot help if they do not know. So do not, when it comes to these medication costs, because you're not the only person that's facing these medication costs. It's there are other patients that are in there, and not only that, like I said, if the doc themselves doesn't know, sometimes they refer. They might, give a call to the pharmacy, and if nothing else, sometimes there are social workers that might be able to kind of help with, if not finding lower alternatives, sometimes you may qualify for certain programs that can be used to lower your medication costs. So they're all sort of there's a lot of assistance that is out there, but you have to ask, and you have to let it be known that this medication is, this is quite a bit. So make sure that you say something about that. Okay, so now that we talked about that, the medications, because I feel like medications is what I see a lot of. The other thing is going to be cost barriers to care. So we're going to back out a little bit. We're going to back out a little bit, and we're going to focus on cost barriers to care. And so, because sometimes it's not just the medications, it's access to care itself. And people can delay their care because of cost. Because remember, you going to your docs, there's, depending upon your insurance, there might be a copay. And yet again, your doc probably doesn't know, what your copay is, unless especially if it's a bigger group, or that the billing part is kind of outsourced. They may not know that your copay has gone from $10 to $30. Or like I said, I've recently seen some of the copays be as high as 50 or $60 for a copay for your insurance. And that's a huge barrier. That's a huge barrier or barrier whenever you're talking about, hey, you might need to be seen every month or every couple of weeks, depending upon what sort of medical conditions you might have. So these things are real. They can be barriers to care, and it's something to always think about. As clinicians, we're kind of insulated because of the way this stuff works, unless we ourselves are getting care, or we're taking care of someone that's getting care. But one of the things you want to do is make sure that this stuff is known. So there's not just a copay. Remember, whenever you're trying to go access care, what do you have to do? What the hours for most clinicians, for most physicians, are going to be, the same time that everyone's there. So open up at 8, closing at 5, 6 o'clock. That's when you work. So you got to take some time off work. You got to drive there. You got to sit around the whole 9 yards. And so you got all these things that if you are having financial difficulties, make it much harder to access the care that you need. Okay. And this also becomes a bit of a problem. Now you add to that lack of a trust in the system, because you're like, oh, they just want to get my money. Is it really that, or is it because money is tight and you're trying to justify the reason why you don't go? Okay. Or don't get the labs, or don't get the medications. And so all these things compile together to become a barrier to the care that you need. Now, what can happen when you delay care? Small problems can become big problems. Your blood pressure goes unchecked. Your diabetes can get worse. Your kidney disease can progress. And a lot of these chronic diseases, if you can get, well, I guess a lot of diseases in general, if you can get access early, if you can prevent the disease, if you can prevent the heart attack, it's going to be cheaper than emergency care. And that's something that's very difficult for people to understand. And that is that, that preventive care is often cheaper than emergency care. But one of the things you can compare is like, yes, your copay to the doctor might be $50, but if you walk in that emergency room, if you walk in that emergency room, you're going to pay $50 for the aspirin they give you. Okay. So the cost inside the emergency room is going to be a lot more than the cost inside your primary care practice. And this is something that a lot of people don't understand. And so it becomes very, it's just something that if you, and especially if you haven't experienced any sort of health crisis or anything of that nature, and you've never gone into the emergency room, it's kind of hard to understand that if I don't take this blood pressure medication, that I'm going to suffer a condition that's going to wind up putting me in the emergency room or get you admitted to the hospital. And there is nothing more expensive than going into the hospital. And especially when you look back and you realize that this is something that could have been prevented prevented before you got there. Okay. So preventive care is cheaper than emergency care. It's sometimes it's hard to conceptualize this stuff, but those small problems can become big problems whenever you're not getting access to the care that you need. Okay. So yet again, we kind of cover this. We're talking about the issues. We're kind of raising that flag of awareness so that you can understand what's going on there. However, we also want to give you some possible solutions for this. And possible solutions are community health clinics. So see if you may have primary care, and like I said, maybe things change around. So you may need to look into a community health clinic. Sometimes health fairs. If you got blood pressure issues and you haven't had a chance to buy a blood pressure cuff, but you still want to get checked out, go to a health fair because sometimes at health fair they'll have people checking, but there'll also be the hospitals, clinics, and docs that might be able to work with you to get your condition under control. Telemedicine options. So one of the things that we have now is a lot of telemedicine options where you can see the doc on the TV screen on your phone, and you can get care through telemedicine. And that allows you to, especially in places where you can't get out work, or maybe the clinician the doctor you want to see is across town, but your job is here. You get off at 4:30, but you can't make it over there until it takes you 40 minutes to get there, and they close at 5. Maybe you do a telemedicine option. So you get off work at 4:30, 4:35, you're on telemedicine, you're getting yourself checked out, getting the medications you need, and you can kind of go from there. So that's another solution. And then of course, establishing a primary care doctor. And I always push this on this program, and that is getting a primary care doctor before you need your primary care doctor is always important because even though it's a little difficult nowadays, I will admit, to get in for those urgent needs, it it becomes very difficult if you're not an established patient to get in. So you always want to get your primary care doctor established early, get your screenings done early, so you can prevent having to go to the urgent care or emergency room for conditions. Okay. The other thing you could do is, of course, know your numbers because you can't manage what you don't measure. And the other thing is, if you know these numbers ahead of time, like I said, you can prevent, or you can minimize or prevent urgent issues from coming up. If you know your cholesterol is high, it gives you, hey, you know it now. Like I said, now you can start working on ways to reach out and get the medication you need to get your cholesterol under control. Blood pressure, same thing. If you know it's a little bit high now, you can start working on ways to get that blood pressure under control so that it doesn't become a stroke, a year later. Okay. So know those numbers and manage those numbers. Okay. Now we talked about what happens when when you when you don't have the funding, what the cost barriers are. But we want to also talk about practical strategies to reduce financial stress. Okay. So, you want to manage your stress directly. So, even if money is tight, you want to do some deep breathing exercises. You want to do some walking. You want to pray, meditate, and you want to talk to someone you trust. Why? Because like I said, that stress is there. The chronic stress makes m- medical issues you have worse, and it doesn't help solve anything. It doesn't solve anything. So what you want to do is you want to do, even if you have stressors, you want to do those deep breathing exercises. You want to walk that 10 to 15 minutes a day, pray or meditate, and talk to someone you trust. Why? Because now, number one, you can get that stress level down. Okay. Get that stress level down a little bit. And then you can start working on solutions. How can we find out what's going on there? It may be that you're spending too much. All right, you door dashing every day. All right, well, don't door, like how about we cook at home? We're not going to eat out. We're not going to door dash. We're going to get some eggs and salad, salad, and bring it to the house and start doing that sort of cooking. And like I said, making things stretch out. Learning how to make a meal stretch multiple days and in a healthy way. So we want to do those sort of things. But like I said, if you're stressed out, sometimes your mind is not thinking the way it should. Okay. Then, like I said, making simple plans. You don't need a perfect budget. Sometimes it's a matter of looking at what's coming in and what's going out. And, the awareness can reduce the anxiety. Yet again, that same example. So, you're making $100 a week, but you spend $150 on DoorDash. So those sort of things are what you look at. And sometimes you have to write it down. And when you write it down, it's kind of interesting because sometimes you can know it, but like when you write it, you can actually see it and you can start making plans around how to do this. Okay. The other thing, you want to use community resources, like I said, see if there's any food assistance programs, medication assistance programs, local clinics. Yet again, all those things that can kind of help you when you're in financial stress to kind of lower the stress and kind of meet the financial needs that you may have. And even, and the other thing is this, and that is you want to also stay connected to care. Even if you can't do everything, do something. Check the blood pressure, go to screening, stay engaged. Don't disconnect because of financial reasons. Because like I said, little problems can become big problems. Okay. All right. So, I think we're coming to the end of the show. So if you remember nothing else from the day, just remember that financial stress is real, but it doesn't have to control your health. It's real, but don't let it control your health. You want to take some control back. You want to keep logs of your blood pressure, take your medication as prescribed, talk to your doctor about costs, and find a healthy habit that you can start today. Okay. Now, if you're in Ohio, Pressure MD does offer telemedicine visits, so you can always reach out and if you're interested in telemedicine or learning more about it. So for everyone that's listening, whether you're listening to WVOE, you're listening to the live stream, you're watching a recording, follow, and share this message with someone who needs it or someone that may know someone that needs it. Okay, because somebody is stressing about money and it's affecting their health. Yeah, as always, we also want to put a disclaimer. This show is for educational, entertainment purposes only and not medical advice. Please talk to your healthcare provider for any personal medical care. And if you're having an emergency, call 911. So this has been Health Facts with Dr. Brown. Thank you for tuning in, and we look forward to seeing you next week.
All right, Dr. Brown, thank you very much, and we will talk with you next week.
All right, take care. All right.
You have been listening to Dr. Brown here at WV.